Hi, good evening, everyone. Thank you for joining us tonight on our Facebook Live healthcare transition into adult healthcare. I'm joined by my co-partners all here, our CT KASA Kids and Self Advocates members who are going to help and answer some questions that were submitted to our group by parents and youth, adults who are looking to get answers on how to transition from pediatric medical facilities into adult healthcare. Before I begin, I want to give you a little bit about our organization and introduce myself. My name is Andrea Richardson. I am a mentor, youth mentor for the organization that I just introduced to you, our CT KASA Youth. And I'm also a health information specialist for our organization known as PATH CT, which is Parents Available to Help Connecticut, which is a free statewide grassroots parent organization. We are affiliated with 4 national organizations: Parent to Parent USA, Family Voices, YASA, Youth and Self Advocates, and National Siblings Leadership Network. We are dedicated in connecting and empowering families, children, and youth living with disabilities or special health care needs through support, education, and advocacy, while offering emotional and informational support to families, promoting partnership with families of diverse backgrounds, and collaborating with healthcare providers, community organizations to improve services and policies that serve our children. What we do: Parent Support Program, one-to-one family matching services, CT, Family to Family Health Information Centers, CT KASA, Kids and Self Advocates, Youth Leadership and Advocacy Network, ages 13 to 26, Sibling Leadership Network, Leadership Support Advocacy, Charting the Life Course, Genetic Resource and Advocacy, Special Education Advocacy. We have a monthly newsletter that goes out, speaker programs, and we provide free trainings to everyone, adults and young adults. With that being said, I know it's a mouthful, but we are a very hefty, loving community organization that looks to support families. And our youth, our presentation tonight is to give you some pointers as young adults and parents on transitioning to healthcare. I first would like to have our members here introduce themselves, and I'm going to pass it off to Emily Cowan.
My name is Emily Cowan. I'm the youth coordinator for CASA.
Thank you, Emily. Well, the next person we're going to have introduce himself is Victoria Nuss.
Hi, I'm Victoria. I am the KASA representative on the PATH board.
Thank you, Victoria. Welcome. Next person we're going to have introduce himself is Caitlin Ramos.
Hi, my name is Caitlin, and I'm a member of CT KASA.
Thank you, Caitlin. The next person we're going to have introduce themselves is Samantha Nuss. Unmute yourself, love.
Hi,
Thank
I'm
you.
Sammy, and I'm a co-chair in KASA.
Thank you, Sammy. The next person that's going to introduce themselves to you is our very own Emily Ball.
Hi, everyone. I'm Emily Ball, and I'm the Youth Outreach Coordinator for PATH CT.
And our very important technical support person is Marnie McNiff, and I'll let her introduce herself.
Hi, I'm Marnie McNiff. I am a parent support advocate with PATH, and I am also our tech guru tonight. So if you have any questions for the group, please put them in the Facebook chat and we will get to them at the end. Thanks.
Thank you, Marnie. Thank you guys for that wonderful introduction. Once again, I just want to say thank you for joining us tonight on this very small training. We won't take much of your time, but a very important topic that affects lots of young adults and parents. And we would like to be one of the first out there to help bring some insight and understanding to transition for pediatric healthcare into adult. So let's begin without any further ado. I want to go over some questions that we received from parents. The first half is going to be parents' questions and what the youth had to say in response. And the very first question is, as a parent, when should I start the steps for healthcare transition? I'm going to take this one. First, get the conversation started early. The first thing to do is to have a conversation with your child and your child's pediatrician. When speaking to your child, find out if they feel comfortable speaking with their doctor without you being there, and come up with a plan to help them find their voice in their own appointment. At the next visit, have them start to answer some of the questions that the doctors might pose to you. Don't be so quick to speak up. Give them some time to let them be able to come up with their own responses. Next, have a conversation with your child's provider and ask them, what process do they believe is the right process for you to begin this transitioning process out of their care into an adult care provider? Tell them that you want your child to start taking control of their visits and to help prepare them for the next time that you guys meet in their office. See if your provider can offer some recommendations, any family medicine facilities, internal medicine providers perhaps, or adult adolescent medicine facilities that does both adult and PD healthcare to consider, and start researching some of these doctors to make sure that it will be a good fit for you and your child. The second question that was submitted to our group that we will answer tonight, and we're going to have our very own Emily Ball take that. And that question is, at what age should you begin the transition from pediatrician to adult care provider? Emily, what do you have to say about that?
You should start planning for your transition at early age of 12, but the process officially begins at the age of 14. At that age, the child should be learning more about their diagnosis and their medication plan. And how to make an appointment, and what they will need to bring with them for that appointment, for the visit, and how to help them understand the purpose of the appointment and why it's important.
All of that is very important. And even as your child is getting ready to do some of these things on their own, walk through the process with them, talk it through with them to make sure they understand what's taking place. The third question that was submitted by our parents who would like to, what they would like to know, and that is, what is my role as a parent during this process? Do I say stuff? What am I supposed to do? And the answer I'm going to provide to you tonight is, first is, you want to make sure that you educate your child on the proper medication usage and its side effects, the medication that they're currently taking or the ones that they might be prescribed, and how to look up those type of medication side effects so that they will be knowledgeable about that, as well as how to refill or fill their own prescription. Encourage them to be independent by allowing them to make their own appointments. Show them your support at their doctor visit by giving them the space and the privacy that they need to be alone with their doctor. This might be a little challenging as a parent, but you can do it. I have faith in you. Give them a chance to practice speaking up for themselves. Healthcare changes and needs are very important, but they need to be more educated about it in order to be able to have a voice in it. You should get them a medical journal so that they can log all important information that they will need, the things that they need to know. They're not going to remember it all, so a journal might be a good tip. It can be digital or electronic, as well as they can log it in a notepad, whatever is more convenient for them. These are websites that I would like to provide with you to help you on your search and finding better ways of logging this information. The first one is called Medic Alert Foundation. We're going to provide this information in the chat for you as well. The second one is called Sticky Jewelry. The last one is Medical USB. Remember to start early in this process and to slowly roll over to your child the control they need and allow them to take the wheel. This will be a trip you both will be taking together. No rush. Enjoy the process. We're going to transition from the questions that the parents submitted and move on to some questions that our young adults need to know in this process, because they're the ones that are looking to take over and would need to be educated as well on what the expectations are. Our KASA youth members are going to help provide us with those answers as well. So the very first question from a young adult wanting to know what they need to know in this process is, what should I know about my own healthcare needs? And when should I speak up? Emily Ball is going to try to help us answer that. We're going to answer the question on what you should know about your own healthcare needs and when you should speak up. Emily, are you ready for that?
Yeah.
Take it away. I see that the answer you gave me here, if you want me to just get started for you, it says you should be familiar and informed about your body, like your weight, your height, your primary diagnosis, and any allergies. You should be able to identify when you are sick and when you realize that something is wrong, and make sure to tell someone so you can get the help you need. You then should speak up and contact your doctor through my chart. You should know what things can make you feel better and what can make you feel worse. All of that is very important. Did you want to add anything extra to that, Emily? You've gone through this process.
No.
Okay, thank you. The second question that was submitted for young adults is, what to do if you're not feeling well? That is going to be answered by our very own Sammy Nuss.
Is to inform those who live with you and keep a medical journal that tracks the way you are feeling, the foods you ate, and if you're sleeping well, anything that may affect the way you are feeling. You should have access to your insurance card, and it's very important to know who your doctor is and how to get in contact with them in case of an emergency if you have one.
Thank you so much, Sammy. That's a very valuable point. All that information you should have accessible to you as a young adult. The third question that was also submitted was, what you need to know before you make an appointment to see a new doctor. Caitlin Ramos, can you help us with that?
Yes, you need to find out if the office is accessible. If you can't access the building, then you need to choose a different doctor. Also, make sure they take your insurance card and ask if you have a copay and how much it will be. You can take money to pay upon checking in. If not, you will receive a bill for the visit.
Oh, guys, that's like one of the very first lessons in adulting, is to learning that the money that you make has to go to bills. So why not begin with the healthcare process? Our fourth question is, what will happen at an appointment? Emily Cowan, can you help us with the answer?
Yeah.
First, you check in at the window and give the medical receptionist your insurance information. Then you will be escorted to an exam room where you will wait to see your provider. When they arrive, you will be asked what is the purpose of this visit. You should be prepared to communicate what the reasons of this visit are. This is your chance to speak up and allow your doctor to trust that you can communicate your needs. If you are nervous, have a parent or a friend go in with you for part of the visit until you feel comfortable. You may also write down your questions and comments or have them written down to give to the doctor at your visit.
Okay, guys. Number 4, that's the proof is in the pudding. That's where you are now the person with the microphone communicating with your provider. This is your opportunity to make them aware that not only that you have a voice, but you know what your needs are and you can communicate it. Thank you so much, Emily. The 5th question, what will happen at the end of my appointment? Sammy Nuss, can you help us with the answer?
After exam, the doctor may want to order tests or start a treatment. You don't have to agree to all the tests or treatments. If you are not sure, ask questions and make your own decision. After you decide, you and your doctor will agree on a plan of treatment and make sure you get written instructions. This way you don't have to try to remember what you need to do. If you took a medication before and you don't like the way it made you feel, it's okay to tell the doctor and they may prescribe you something else. Find out if you will need another appointment, and on your way out, stop at the front desk to schedule your next visit and make sure to make an appointment card.
Thank you, Sammy. Here is a question number 5 is a good place where you want to make sure that when you go to those visits, take that medical journal with you. So when you get the answers to some of the questions the doctor is providing, you write them down. We don't expect you to remember it all. That's why that journal is going to be very important. Last question for tonight is, how do I change doctors if necessary? Victoria Nuss is going to tell you all about it.
Sometimes the doctor you are using just does not work out for you, and you need to change doctors. You can look up a doctor by their specialty or call your insurance company for local providers. You can ask other people you know about doctors they suggest. You can also check www.md.com or www.healthgrades.com and other websites to see how other people have rated doctors. Once you have identified a doctor that seems appropriate, call to set up an appointment. First, check to make sure they are taking new patients. You will have to complete a form to request your medical records transferred over to your new provider.
Wow. Sounds like a lot. Thank you, Victoria. But it really isn't. Once you do this over and over again, you'll be a pro in no time. It's okay to be nervous. It's okay to not have all the answers. That's all right. Write them down. Think it through. So when you go into your appointment, you go in there more prepared. That's all the questions that were provided to us. And these are all the answers that we were able to give you tonight. I'm not sure if we have any questions in the chat. I'm going to check in with our tech guru, Marnie. Can you let us know?
Hi, we do not have any questions as of yet, but feel free to comment and we can respond after. This video will stay up on our page, so we're happy to respond. I'll also put in a contact email for Path, so if you want to reach out directly, you can do that as well.
Thank you. Thank you so much. Well, thank you guys for joining us tonight. I hope it was not too much information. I believe we did our best to provide you with the answers coming directly from the youth, by the youth, because we want to be able to have them communicate with their peers. Parents, I hope you were informed tonight and that you might begin the process after meeting, seeing our presentation, or even, just start the conversation. Like we said, just start early. Once again, thank you. And we are going to be having an additional presentation in September on, so stay tuned for our another Facebook Live session, but this time on educational transition. I look forward to connecting with you guys again in September. Enjoy the rest of the summer and stay cool.
All right, I stopped it. You guys did great.